We saw the number of coronavirus cases yesterday in our state jump to more than 58,000 cases. And despite the rise in cases, there's some light here. Deaths have declined. Arizona's family has analyzed recent data and found that there were 310 people who have died so far from the coronavirus this month. Compare that to May, when 558 people died. But the Arizona State Health Department says ICU bed capacity in our state is at 84%, and COVID-19 patients in the ICU also at an all-time high this morning. In fact, we have seen the number of COVID-19 patients in hospitals double from June 1st, which was at about 1,300, to now more than 2,700 from the beginning of this week when we last looked at the numbers on June 22nd. So a lot of numbers, a lot of questions about this. This morning we are talking to how doctors are dealing with this increase. Dr. Janice Johnston is the medical director over at Redirect Health. So thank you for joining us this morning, Dr. Johnston.
You're welcome. Thank you for having me.
Let's talk about this, the double in number of people in the hospitals. How are hospitals, medical centers, how is everyone handling this?
So definitely we are all seeing an increase in calls from patients who are concerned about symptoms and possible exposure to someone that they know who has tested positive, either in their family or at work. We are encouraging everyone who is concerned to reach out to your primary care doctor and get some advice as to what to do. Should you get tested, where can you get testing? And as the number of cases are increasing, we're definitely seeing that it's being pushed out in terms of how quickly that patients can get tested. It doesn't change in terms of if you have mild symptoms of what we will recommend that you do, because we still will want you to self-isolate if there's any concern that you're not feeling well. So we want to make sure that we reserve people going to the hospitals and the emergency room for those who are having significant and severe symptoms. And otherwise, if you're having more mild symptoms, which honestly is the bulk of people that we're dealing with right now, we want to try to keep them away from the hospital so the hospitals can deal with the most ill patients and also be able to deal with people that have other medical emergencies like heart attacks and appendicitis and all the other things that you're going to need to go to the emergency room. We want to make sure that they have the ability to look after the most significant of people.
Mm-hmm. Let's talk about, you mentioned not rushing to the emergency room, obviously, unless you are in dire need at that point. See your healthcare provider first. We're still encouraging, obviously, people to call first, do telemedicine. What about testing? Because a lot of people are saying, I want to get tested. The lines have been long. Our health centers, are you guys finding over at Redirect Health that you guys have enough testing? And what has been the wait for folks who want to get tested because maybe they've been exposed, know somebody, not necessarily feeling all the symptoms yet?
Yes. So we've definitely seen an interest and need for increased testing. At this time, we have adequate tests to test anyone that we do feel needs the test. So that doesn't seem to be an issue at all. In terms of how we do testing, at Redirect, we do like to triage everyone first through a medical provider to see if it's indicated, and we do it through a drive-through system. And that's both to make sure that our medical centers are kept safe for other patients that are coming in for other medical needs, and also to protect and preserve our PPE for our staff. PPE is still somewhat limited, and so we do want to make sure that we're using all of our supplies judiciously and safely. The other thing is it's getting hot out there right now, too, and so we need to make sure that we are protecting our staff so that we don't have our staff out there in 111 degrees for all day long. So we try to contain our testing to when the temperatures are lower. But at this time, we do definitely have adequate testing, and we would encourage anyone who is concerned to give us a call at redirecthealth.com, and we can definitely help you. Our number is 888-407-7928, and we can help to direct you. We sometimes are pushing people to the next day or the day after, and that's pretty much standard through all of the testing centers that are across Phoenix right now.
Okay.
So even if you,
all right.
if
well,
you
thank you
don't
so much,
get to,
Dr. Johnston.
You're welcome. You're welcome.
We appreciate your time. Again, they have several locations across the valley. We'll put all the info as well on azfamily.com. We know we're in it for the long haul, everybody. Be patient and be safe.